Hello friends, if a patient comes with hemoptysis or coughing out of blood from the mouth, then we have to diagnose the case. We have to know the disease, what type of disease the patient is having, so that we can treat the cause. If we only treat the symptom, then the patient's disease will be left and there will be high chances of morbidity and mortality. So we have to diagnose the exact disease and we have to treat the patient accordingly. But for that, patient has to give the history properly. When a patient comes with hemoptysis in outpatient department, we ask lots of questions and patient family members, they get irritated. Why these doctors asking so many questions? Yes, I'm having blood in the sputum, I'm having hemoptysis, that's all. No, actually it's not, because we have to know the detailed history. We have to know whether any type of disease you are having, whether you had any medicines earlier, whether you had an anticoagulant, what type of medical illness or surgical illness you had in the past, what type of habits you are having, whether you are dependent on alcohol, whether you are a smoker. Lots of information we need. So don't get irritated, just chill and give the information so that we can come to a conclusion. Today I will discuss the diagnostic clues we can get from history. Sometimes if we escape the history part, like if we don't take the history from the patient, if we don't take the informations, or if sometimes some patients are not able to give the informations, that he is so much sick that he cannot give the informations, or sometimes he is reluctant to give the informations, in that case history is incomplete. That means we are not getting the proper information, and this will affect our diagnosis, because we can get some clues from the history. And I suggest any doctor is taking your history, please give the full information, whatever doctors want to know, so that he can do the exact diagnosis. First of all, coughing out of blood in the sputum means the blood is coming from the lung. Is it so? Yes, you must be thinking like that. It's actually not always correct. So first of all, we have to rule out other organs, other systems, problems in other organs like heart or in the stomach. Patient complains of breathing difficulty if he walks a little or if he takes stairs. If he complains of orthopnea, paroxysmal nocturnal dyspnea, or if he complains of being frothy sputum, then he must be having congestive cardiac failure, he must be having some other disease in the lung, maybe valvular disease or left ventricular dysfunction. So any symptoms related to this cardiac disease, we have to take the history and we rule out the causes. Now come to the gastrointestinal system. If patient complains of nausea, vomiting, any history of gastric ulcer in the earlier years, then or abdominal pain, history of intake of any painkiller, then we should think of causes inside the stomach. Maybe it is gastric ulcer, bleeding ulcer, or gastritis. And maybe the patient is saying that I am coughing out blood. Actually, the patient is vomiting blood from the stomach. So these two organs we have to rule out first. Then come to next point. If the patient is a female, then we have to take the history of menstrual period. If the bleeding occurs during menstrual period, that means this is catamenial hemoptysis. Now, patient's habits. Whether the patient is a smoker. If he is a smoker, think of bronchitis. This is most commonly in our part, this is common. If the patient is taking some anticoagulant medicines, some drugs, then we have to take the history of that, what type of medicine patient is taking and whether the patient is having any coagulative disorder. If the patient complains of weight loss, then we have to think of pulmonary tuberculosis or any immunosuppressive disease like HIV, then lung carcinoma, cancer. The cancer causes weight loss, so we have to think of all these diseases. If the patient is already having HIV, patient is on medicine or just diagnosed as AIDS or HIV, then there is possibility of pulmonary tuberculosis because tuberculosis is common in HIV patient, and some other disease like Kaposi's sarcoma, some cancers are common in HIV patient. If the patient gives history of cancer in the body, if patient had breast cancer, colon cancer, or some other cancer earlier years, or patient was treated for cancer, then we have to think of metastasis in the lung and to bronchial metastasis causing hemoptysis. If patient complains of fever and productive cough along with hemoptysis, then we have to think about respiratory tract infection, chronic bronchitis, bronchiectasis or lung abscess. If patient complains of chronic lung disease, some patients present with lung disease for long time, repeated admission in the hospital, then we have to think of bronchiectasis or lung abscess. Bronchiectasis patient, I have seen they get admitted in the hospital frequently because of frequent respiratory tract infection. If the patient complains of pleuritic chest pain or cough tenderness, then we have to think of pulmonary embolism because the source of embolism may be in the deep vein thrombosis. So these are the diagnostic clues how you can reach to the diagnosis, how we can detect the cause of hemoptysis in a patient. Friends, that's all for today. Thank you for watching this video and stay healthy.